Welcome to Let's Talk About It Sunday, an extension of KELA's weekday local talk show featuring a variety of subjects of local interest. This program was pre-recorded, so we're unable to take live calls on today's show. And now, let's talk about it.
All right, welcome to Let's Talk About It Sunday. I'm your host, Peter Abbarno, here on AM 1470 KELA and 104.3 KMNT. The Let's Talk About It Sunday show airs every Sunday before a Fox News Sunday, and it brings you information about community members, organizations, issues going on, not just maybe in your community, but in the state and nation. And I have a great guest today, Elizabeth Hovde from the Washington Policy Center's here. We're going to be talking about long-term care payroll tax. Some call it Washington Cares. I find that Washington Cares sounds like they care too much because the program is not as good as it may sound. And Elizabeth's going to help explain what the program is and what the problems are. So Elizabeth, thank you for joining me today.
Hey, you're welcome. Thanks for having me.
Yeah, this is going to be a great show because we know that on July 1, there's going to be a lot of working Washingtonians who are going to look at their paycheck and it's going to be smaller and they're going to go, why? And but not to the fault of you or I, because we've been sounding the alarm now for a couple years. Can you talk a little bit about what Washington Cares is?
Sure can. You know, I have too much knowledge about this thing, and I'm interested in how I'm going to tell my teenage son, who got his first job a month and a half ago, why he's getting a pay decrease in July. That'll be an interesting one. But what's happening is the Washington Cares Fund was created by the legislature in 2019 to create a long-term care program funded by a payroll tax of 58 cents for every $100 a worker makes. The fund then, if you pay in for more than 10 years without a break or five or more years, and you health qualify and stay in the state living-wise, you can qualify for a $36,500 benefit for long-term care needs if you have them. That's not enough money for most people's long-term care needs, but it is something that will help people who qualify for it. Qualifications, again, are burdensome and a maybe. So you might get a return on investment. And that's the main problem with this tax is the state is telling people they can have peace of mind about future long-term care needs when they really can't. And what that might do is have more and more people not planning or saving or investing for this possible life need.
So Elizabeth, I mean, you know a lot about this issue, and you and I have had discussions off air about Washington Cares for now a number of years. You work for the Washington Policy Center. So what's your role in trying to educate, and maybe not just your role, but the role of the Washington Policy Center to educate the community about what this Washington Cares is?
My hope was to give lawmakers pause about the program and reconsider it. I've failed in that regard and instead have tried to warn people to budget for this pay decrease that they're going to get. The state has not done a good job informing people that they're getting a pay decrease or informing them about an opt-out provision that used to exist in the law, no longer does. But they need to be informed. They need to be informed that their pay is decreasing. These inflationary times, we have some people living paycheck to paycheck. They don't need their wage to go down for a benefit they may never see. So in addition to trying to get lawmakers to repeal this thing, it was informing people for that reason. And another, a year ago, the governor urged lawmakers to delay this tax and this program because of how many flaws it had. They thought they could fix this program, but I would argue that there is not a fix to having low-income workers hand over a portion of their earnings to sometimes people with means who have no shortage of resources for something like long-term care. So it's just a backward social program. It's a regressive tax, and we needed lawmakers to repeal it. You actually introduced legislation that would have done that, and I'm sorry, more of the legislature didn't get on board. although I know it didn't even get a hearing. So I'm not sure how many lawmakers could have signed on um, to it to make it have a hearing.
Right, right. And if you're just tuning in to Let's Talk About It Sunday with your host, Peter Abbarno, Elizabeth Hovde from the Washington Policy Center is here talking about Washington Cares and the soon-to-be long-term care payroll tax. And and I'm going to exclude myself on this one. Is the public it was smarter than the legislature? I mean, the governor noticed all these flaws, and the voters in advisory votes overwhelmingly rejected the idea of this type of program.
Yeah, I don't think the public is going to like any tax. So I'm not surprised that taxes are not supported. But when looking at how unfairly the law was written with things like charging even people who don't live here and can't use the benefit if they qualify for it someday, was just poor writing of the law. So there were so many reasons to be against it, given the unfair applications of the law, the lack of an opt-out provision that extended to people who weren't working yet, things like this. So I think it's a combination of not liking new taxes and realizing that this is not going to solve our long-term care crisis. And in fact, it could be making it worse.
Yeah, and likely it will. And let's talk about some of the flaws about this program, because I don't think people understand. I've been getting a lot of maybe is it social media ads, and you'll see them on television about, hey, save our Washington Cares program. But what they fail to realize is that if one spouse works and one spouse doesn't, and they're contributing that income towards Washington Cares, that tax is going away and not part of that household income any longer.
Right.
Only one spouse, the spouse contributing, gets access to that fund, and
Right.
your spouse may be the one who's and let's not forget, we live in a community property state, but the spouse who's not contributing or working never gets access to that money ever again. And that just seems unfair in a community property state.
Absolutely. And another really unfair part of the law that I've been trying to get lawmakers to change is that the vestment criteria is that you have to put into this, you have to pay the payroll tax for 10 or more years without a break of 5 or more years. You're ruling out some of the very people lawmakers say they created this tax for.
Right.
You're ruling out at-home caregivers, you're ruling out sandwich generation, people who care for their kids and then care for their parents, who work in between sometimes. It's just really short-sighted. And, there's so many things that rule a person out. And I don't think people realize that when we're hearing about on social media, on my Pandora station, how Katie and Sally and Janet, I don't think Janet has been used yet, but how Katie and Sally are caring for people and they could have used the money. Another thing about giving money to the caregivers, which is a primary reason for this tax, is so that you could pay a family caregiver who's providing long-term care services for you, is that if you're a beneficiary, you can't just dole that money out to whoever you want. The caregiver is going to have to have state required training to be a person who can receive those funds. They will have to be associated at some level with the SEIU 775 union and receive their training from them.
Well, and that's a really important part too. Just talking about the people who are going to be potentially contributing to this program. If you're close to retirement, you could end up contributing to this program and never seeing a benefit at all, because you may never get vested.
Well, now they actually have tweaked the law last legislative session, so 2021, to give a partial benefit to people who are near retirement. So people born, I think, before 1968, correct me if I'm wrong, will receive 10% for each year they pay in. So they'll receive some, but we already know this is an inadequate amount for long-term care. Genworth numbers show that this would probably pay for about 3 months of nursing home care in Washington State. It might do a tiny bit longer for at-home care. this is an inadequate benefit amount. It's going to be very inadequate at 10%, 20%.
Right. So if you're close to retirement, you can be contributing really into a program and really not get an impactful benefit from it. And quite honestly, you just made the point. 36,500 even adjusted is not going to be a large benefit. When we heard testimony in the legislature, most said this would be 3 to 6 months, depending on whether it's in-home care or not. You're not going to, it's not long-term care. It's really short-term care at best.
It's a long-term mess. And that's the real problem is the state social and media campaign, which is really robust, is telling people you can have peace of mind about long-term care. You cannot. They're lulling people into a false security. And it worries me. What they should have been doing, the state and state agencies and lawmakers, is raising awareness to the issue. You know, one of the only silver linings of all of this is that it has people thinking, oh, I might be a person who needs long-term care. This is something I need to make plans for. So by telling people they have peace of mind, they don't have to worry about it, is just so misguided.
Well, and it creates a false perception that your long-term care needs will be met. And a lot of people will not contribute privately, whether it be through a rider on a life insurance policy or a standalone policy, because they think they're being taken care of, and they're not.
Yeah, no, totally agree. You know, the private long-term care insurance providers, that was another thing. When the state decided to intervene with this industry, the market shut down. People were racing to get private plans that would do better by them if they needed long-term care someday and give them a return of investment. And the state intervention made it so this gold rush on long-term care insurance plans had sellers not able to sell. So a lot more people, you know, almost 500,000 people opted out of the tax under a limited small window provision to have private long-term care insurance instead of the program and opt out of the payroll tax.
Which supports the advisory vote, right? I mean, you had 63% of Washingtonians saying they didn't want this program, and then you had 500,000 Washington workers say, I want out as quickly as I can.
Exactly. And I think the more and more people know about Washington Cares, the more they dislike it. And that's why you're seeing the media campaign so short on details and really strong on highlighting Katie and Shannon and whoever. I think I'm getting it wrong. I just heard Katie this morning. It's the only one I'm really sure of.
Well, and the other thing, too, that people have to realize, if you contribute into this program, what happens when you move to, if you decide to retire in Arizona or Florida or Texas or somewhere else?
Yeah, you're out of luck. So let's say you pay in for 40 years. You don't even work yet. You're 18 or 50 years or 60 years or whatever. If you move out of the state for retirement to be close to your grandkids or to get some sun, you're out of luck. The program, the benefit is not portable. So you'll lose out on any money you put in.
And partly because, which makes this program really confusing, because there's a vesting process, but it's not portable. But it's also not a possessory right that you can leave in your estate. Or as this scenario I gave before, what if you don't need long-term care, but your spouse does? Right. Your household has contributed all these years to it, but you can't transfer it to your spouse.
Yeah, and a commission that's overseeing the implementation of WACARES, they have been talking about granting a portability option of some sort. And every time it comes up, you're basically made aware that it's not financially feasible because they're not even sure this thing is solvent. You know, the number of opt-outs hurt solvency. It wasn't solvent even before the opt-outs because voters rejected a funding measure that related to how the state could invest the funds. That's another problem. And, you know, even if these problems didn't exist, we see that social programs started by the state don't usually pay their own way. The paid family medical leave, that, you know, the rate for that social program is doubled in its short lifetime.
Right.
And I don't see any reason why this one won't also go up over the years.
Well, and I served as a co-chair on the Paid Family and Medical Leave Task Force over the last summer, 2022. So I'm keenly aware of the problems of some of these programs, which, raised my awareness of Washington Cares and the problems of solvency they're having. Are you getting, because I get this a lot, folks who this was supposed to be quasi insurance. It really is merely now a social benefit.
Well, at least the state is finally being a little bit more honest about that. It was never, they can call it an insurance program all they want, but it's not. It doesn't ensure that you have anything if you have long-term care needs.
Right.
It ensures that they will take 58 cents from every $100 you make and give it to somebody for long-term care, not necessarily you.
Right, right.
Insurance program.
Right. And I received an email not too long ago, because I get a lot of emails talking about don't take our benefits away. And it alluded to the fact that they thought that $36,500 was a yearly benefit. It's a lifetime.
Yeah, it's a lifetime benefit. And I think some people are confused because there was language in the beginning about so much a day for a year. The reality is that the so much a day per year for the whole year would amount to nothing. But that provision was stripped out of the law. Now it's just a flat $36,500 to be used for expenses that you incur for long-term care if they're approved by the state. We still aren't sure what all that is going to look like. So I'm really hesitant that this will benefit anyone. And again, for the low-income worker who's barely making ends meet, you're taking money from them today to give to somebody else with more means in some cases and who may not need the money. It's a crazy thing. And the reality is those people with low means and low assets would have qualified for Medicaid long-term care. So they're paying now for the benefit that they might be receiving.
Right. Well, and I joked a little bit about the fact that, and I don't encourage this, because I think there's this misnomer. If you oppose the Washington Cares program, it doesn't mean you don't think long-term care is important. I think it's vitally important. And I, as an attorney, I've advised my clients, you should look into this. This is very important for you. So it's not that I don't think long-term care is important. I just don't think this program is the right program, right? I mean,
exactly. I mean, the reality is research is showing us that 7 of 10 people do use long-term care. So it's something that's going to hit a lot of us. Our population is graying, it's growing, people are living longer. The problem is for some people, this program and long-term care insurance in the private sector are not the best ways to get there.
Right.
Investment in real estate might be. If you have family money that passes around, that might be a better way. There are tons of different investments we can make and are individual to us, right?
Mm-hmm.
And the goal of the state should be letting us make patient-centered decisions for our care. And this gets totally away from that.
Well, and as I was saying, even my earlier comments, I've joked about the fact that if you take the same amount of money, and my children are 10 and 11, going to be 12, when they start working, if they took that same amount of money and just invested it in the stock market, now,
absolutely,
they would have not only more money, but it would be more flexible, and they would be able to use it for their spouse or themselves, or if they never use it at all, they have a possessory right to it.
Absolutely. And that's the key here. Long-term care needs are one of life's needs. We all have many life needs and different ones at different times. And it would be an appropriate state role to raise awareness about the need that people might have. That's what our savings and our assets and things should be for. One of the big problems that led to even proposing a long-term care program like this was that Medicaid allows for some long-term care costs to people who are eligible for Medicaid. And in so doing, there's no secret in Washington that that's a financial planning strategy for some people to get rid of assets so they can qualify for Medicaid's long-term care support. And this is a safety net that's built for people in need, not for people not in need. The state should be shutting down that abuse and preserving dollars for people in need.
You are listening to Let's Talk About It Sunday, an extension of KELA's weekday local talk show. Stay tuned. Let's Talk About It Sunday edition will return in a moment. Let's talk about it. Good morning. You're listening to Let's Talk About It Sunday, an extension of KELA's weekday local talk show. This program was pre-recorded, so no live phone calls on today's show.
If you're just tuning in to Let's Talk About It Sunday, I'm your host, Peter Abbarno. My special guest today, Elizabeth Hovde with the Washington Policy Center. We're talking Washington Cares, a long-term, quote-unquote, short-term care program that's established by the state of Washington and will soon be taking 58 cents out of every $100 from your paycheck if you didn't get the opportunity to opt out during that really small window. You're going to start seeing that deduction on your paycheck, and we're talking about what those benefits are, what those benefits aren't, and what we're trying to do about it. Elizabeth, we had a bill a couple years ago to repeal it, a bill this year to repeal it. We also had a number of bills that address some of the community concerns. I hear a lot of concerns about portability, or whether or not you can transfer it upon death, giving you a possessory right. Are these fixes, or are these just addressing concerns?
You know, I think the lawmaker tweaks that were made a year and some change ago, really were made to quiet the growing disapproval of this law. You know, we should bring up the 4 new categories of exemptions for people who actually fall within those categories. There are exemptions that have been carved out now, voluntary exemptions. You're not exempted outright. You have to seek it out. But if you live out of state and work in the state or for a state company, you can be exempted if you seek it out. Some disabled vets can get exemption, as can military spouses and non-immigrant visa holders. So these people in these categories can opt out, but if they didn't do so by June 1st, which is already past us now, they will be paying into this likely on July 1 when it begins, and they will not be reimbursed for anything that went in, even if they are someday exempted from the program.
Well, in one solution that I proposed in an amendment at one point was to allow for an annual opt-out window, and that was shut down pretty quickly.
Shut down because it's not solvent.
Right.
They need all the money they can get. And, you know, I'm not even sure, I'm trying to do the math on this right now, but I've had some people in the industry tell me that if they have more people who can buy private long-term care insurance, the state would be better off. I'm not sure if that's true or not. I haven't done the math, and I don't know the math, but there's an argument to be made that the more people who have provisions, the fewer people who are going to go after this financial strategy of qualifying for Medicaid. You know, given that it's $36,500, if a person lives a year on long-term care and they run out of the money in 3 months, they're going on Medicaid anyway if they're in need.
Right.
So it's not going to avoid that problem.
Yeah, it's kind of pushing it out. It's kicking the can on a problem, not solving it.
Exactly.
Well, and so what are some of the solutions? There have been some ideas thrown around the legislature. You know, even I've thrown around the idea of maybe what we should be doing is incentivizing the purchase through private industry. It may have actually just be simpler than that, which is just education. And you brought that up early on to let people know, to create competition so that you can create maybe more flexibility in the plan. So it drives the cost down to make it more accessible to people. That is a cheap way to maybe help solve this.
I think so. And, you know, one of the things I mentioned too was ending Medicaid abuse. I think that's huge. I think that we need to make sure that we keep safety nets for people in need. Washingtonians are generous. No one wants an elderly person in need, unable to care for their daily things. So That's not the issue. The issue is saving that money for people in need. And another way is increasing awareness. And instead of maybe incentives, I'm not opposed to that, but I haven't explored that fully. One of the ways that could help, that the lawmakers could help, is by simply eliminating the tax on insurance products. You know, the part of the reason for this law is because they say that long-term care insurance is unaffordable, and yet we tax it. So make
Right.
it less affordable by getting rid of the tax.
Yeah, maybe coupled with some financial literacy.
Yes.
I mean, again, there's this misnomer and this perception that if you don't like Washington Cares, you just don't like long-term care. And it's actually
Right.
the opposite. I feel like not supporting Washington Cares is actually more fiscally responsible. It's actually because I think there's better options out there, better avenues to promoting long-term care.
You know, that's one of the biggest problems of this is that the state decided to make this a war between private long-term care insurance private long-term care insurance versus the state program. There are so many other avenues. For some people, a private long-term care insurance program makes sense. I might be one of those people. I'm a single mom. I'm not a woman of means. That might be a good thing for me. I have it. But for other people with more income to invest and do things with, it's not. So there's just so many avenues. People should be able to explore those, retain their choices, and hopefully get a lot of us not needing the state Medicaid dollars that are available for long-term care.
Well, Elizabeth, if somebody one of the listeners wants to learn a little bit more about long-term care, wants to follow you in the Washington Policy Center and maybe learn about what you're writing about, how can they get in contact with you? How can they read more about what you're talking about in long-term care?
Great. Yeah, we have a blog at the Washington Policy Center, washingtonpolicy.org. And my blog there, I run the healthcare section of our organization, as well as the worker rights section. And on our blog, I'm writing weekly, if not 3 times weekly, about this issue. Follow me there.
Yeah, they can follow you on Twitter and all over social media too, because I follow you on Twitter.
Twitter, I'm at WPC Elizabeth.
Yeah. Well, you've provided a lot of great information. I appreciate you joining me on the show today.
Thanks for having me, and thanks for your efforts to get this thing repealed.
Yeah.
Sorry it didn't work.
Yeah, well, we're going to keep trying. And I want to thank Elizabeth Hovde with the Washington Policy Center for joining us. Have a great Sunday.